In Your Health, an alternative treatment for veterans dealing with debilitating pain.
The Department of Veterans Affairs is increasingly embracing non-traditional methods. News 8's medical reporter Jocelyn Memento with more on what veterans at the VA hospital in West Haven are now being offered. Jocelyn.
And Darren, I'm talking about acupuncture, but veterans at the VA hospital not getting the traditional way acupuncturists provide treatment. This one has a twist to it. It's battlefield acupuncture.
It's Thursday, the only day of the week this clinic is open for military veterans looking to manage their pain.
What's your pain level right now?
Now it's about an 8.
This is the Battlefield Acupuncture Group Clinic for chronic pain at the VA Medical Center in West Haven, developed by an Air Force flight surgeon, explains Dr. Daniel Fetterman,
who was trying to employ a new technique to get soldiers either with minor maladies to be able to go into the field, or people who are wounded.
Now those out of uniform are also benefiting. Instead of the traditional technique of thin needles inserted into areas of the body, tiny ones are pressed into 5 specific locations of the ear. Eventually, they fall out on their own.
The theory is that there's some connection between the ear, those parts of the ear, and the parts of the brain that experience pain. So it's really just to get the blood flowing. So it doesn't really cure anything, but it decreases the activation of the painful centers.
Internal studies show it's effective for short-term relief.
We found that 88% of people will have a decrease in their pain score immediately after completion of the first treatment.
For Marine veteran Rick Bakies,
I can feel about the 3rd set. Between the 3rd and 4th set, I can feel actually relief. It just takes the pain and drops it.
the standard acupuncture and medication didn't work for his knee pain.
You got to try, keep trying until you find something that works. And to use something without medication is the big thing.
It's back and joint pain for Air Force veteran Albert Ottaviano.
As I was getting the needles, I was talking to him, and I was saying it's gotten down to about a 2.
He comes in every 2 weeks.
I can get back to exercising to bring that strength back to those muscles.
What matters most to both men, that more veterans take advantage of this novel approach.
A clinical health psychologist and a clinical dietitian are also part of the acupuncture team. For more information about battlefield acupuncture at the VA in West Haven, download the free News 8 app or head to WTNH.com.